During the prevention and control stages of the COVID-19 outbreak, protective measures such as stay at home, wear a mask, and wash your hands have been strictly followed by Chinese people. The measures have been effective at blocking the transmission and reducing the further spread of the virus. Let's see how it's done. Stay at home. Studies have found that the transmission of COVID-19 mainly occurs through respiratory droplets and contact. Spaces that are poorly ventilated and those that have a high density of people and large volumes of foot traffic are considered high risk. Keep at least 1 meter away from others if you must go out. In addition, a balanced diet, exercise, and a healthy daily routine can help boost your immune system. Open windows to air the room at least 3 times a day for 15 minutes each time. Wear a mask. Not all masks can prevent respiratory infections. Cotton masks, sponge masks, and protective masks with a breathing valve can't do the job properly. Effective masks include surgical masks that can block 70% of bacteria, and the N95 masks, which can block 95% of bacteria. Zhong Nanshan, a member of the Chinese Academy of Engineering, director of the National Center for Clinical Medicine for Respiratory Diseases, and leader of a high-level expert group, said that although common surgical masks cannot block the coronavirus, wearing a mask is helpful because the mask can prevent the spread of droplets which carry the virus. Therefore, if you do not have to work with patients, put on a surgical mask and leave N95 masks to healthcare workers. How to properly wear a face mask. Make sure the mask is worn as instructed and fully covers the mouth and nose. Squeeze the nose clip for better seal. When removing the mask, hold both the ear loops from the behind. Do not touch the front of the mask. Wearing multiple masks at the same time does not enhance protection. Instead, it will compromise the seal of the masks. Surgical masks are effective for up to 8 hours. There is no need to use a new one each time. Washing or disinfecting a mask will not make it ready for use beyond recommended time. Wash your hands. Wash your hands thoroughly with soap and water. The steps are as follows. Step 1. Rub hands palm to palm. Step 2. Rub the back of each hand with the other hand's palm with fingers interlaced. Step 3. Rub palm to palm with fingers interlaced. Step 4. Rub palms with fingertips. Step 5. Rub each thumb by clasping the opposite hand. Step 6. Rub each wrist with the opposite hand. The whole process should take at least 15 seconds. When do we wash hands? After coughing or sneezing, before and after preparing food, before eating, after using the toilet, after contact with other people, after touching animals, after going outside, when hands are dirty. Use an alcohol-based hand sanitizer when you cannot use water and soap. The coronavirus is not acid-resistant or alkali-resistant, but is sensitive to the disinfectant and organic solvents, with 75% ethanol recommended to kill the virus. With proper protective measures, the spread of COVID-19 can be effectively prevented. Instead of panicking, let's all start protecting ourselves and others.